From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into Open Line. I'm Chuck Long, glad to be along with you for the next hour. Now, we're glad that you joined us this evening. This is Ask the Expert evening, and we're going to ask the endodontist. One of our favorite guests is with us this evening, Dr. Richard Horwat, endodontist. And I tell you, I know when it comes to your mouth, there's so many questions that people often have, whether it's an aching tooth, what to do about a possible root canal, how things are feeling. We're going to have the answers for you. And as always, we love it when you give us calls. So don't forget, your questions, your comments, all you have to do is call us at 737-7587, and we will get to as many of those as we can during the next hour. So, Dr. Richard Horwat, always good to see you.
Always nice to be here.
I tell you, weather's great, fall is coming, life is good.
Life is good. Weather's beautiful in Tennessee. I love it here.
It really is. Now, I always wonder, is there a season? I would suspect that there's not, but there may be a season where it gets busier in your line of work.
You know, I think there might be.
Really?
I think it's root canal season right now. You know, I noticed that in the fall time we tend to be a lot busier. I think a lot of it has to do with the pressure in the air. I think a lot of times you have bacteria that's in your mouth. I think that you may have somewhat of an infection, or the bacteria may be there, but it hasn't really had the right stimulus to kind of let you know that it's there. And sometimes you have a dead tooth, something kind of wakes it up, and I think that the change in the pressure of the air might be that stimulus sometimes.
Okay.
I'm not sure, but we are definitely busier in the fall time with root canals. It's root canal season right now. So.
Well, and for people not watching, you know, one of the things that's always interesting to me, and I think interesting to a lot of people, when you start thinking about your mouth, a lot of times you have a sore tooth or an area that is sensitive and that sort of thing, and you're thinking, is this something that I should get checked out? And your advice is usually, if that's sore or something, get it checked out.
If you're tender, you should get it checked out. You know, oftentimes a patient can come in and they're a little bit tender. Maybe they bumped the tooth. They don't even really know that maybe they were grinding or clenching at night, and it might be absolutely nothing. But if it is something, it can go from a little bit of a tenderness to an emergency fast. So if you do have tenderness in your tooth, it probably would be in your best interest to come in and let us take a look at it. And if, you know, oftentimes when they do come in, if we can't conclude anything, we might make an adjustment here or there and then maybe try to get you back in a few days, maybe see if it goes away, and it might. But you definitely should check with your general dentist if you have a toothache.
And that's normally, too, the way that it is going to work is you go to see your dentist and something comes up, and they look, and if they suspect that you might need that root canal, or they feel that you do need the root canal, they refer them to you. And you guys, it's Bluegrass Endodontics where you are. You have two actual clinics. So
we do. We have a clinic in Mount Juliet. We have one in Hendersonville as well, with Dr. Salen and I, and it's a nice busy clinic. We definitely we get a few emergencies every day, and we usually have a pretty full schedule. But yeah, Mount Juliet and Hendersonville.
Yeah. Now, you're one of our regular guests, so I ask you this, but for those that are tuning in for the first time or flipping through, welcome. We're glad that you're with us this evening. But as far as root canals go, it's always interesting to me because no matter how many times you're on, often I will run into people after the show is on, and they'll say, I had no idea that root canals were not as painful, or that people don't dread them the way that they do. And I say, root canals have changed a lot over the past decade and 2 decades. So kind of tell us about that.
Yeah, it's definitely evolved. You know, I think maybe 30 years ago anesthetics weren't that strong. They've definitely, you know, it's you know, technology, it just continues to evolve, and I think that I have multiple patients per day that are just pleasantly surprised that they just really didn't feel anything. I had a couple today as well. You know, sometimes if they're, you know, we can't always, I've gone online, I've checked out the competition, a lot of them say they guarantee painless, and you know, most of the time we can make it painless, but if there's an infection in there, it might be a little bit tender when we're numbing you up, maybe a little bit. But once we get you numbed up, you really don't feel anything. And if my patients are feeling anything, we're going to back out just a little bit, and we're going to make sure that they're not feeling anything if we're going to proceed.
Well, I think there was a certain time period where people felt, oh, you have to have a root canal, and it was almost like the, you know, oh, that's as much fun as a root canal. I'm going to be off from work for, you know, a couple of days and be recuperating, but it's just not like that anymore.
It's not like that. Recovery time's pretty quick now. Most of my patients are just a little bit tender at the injection sites, but recovery is pretty quick, I think.
And kind of what can someone expect as far as after they had the root canal canal, pain medicine, resting, that kind of thing, or are they able to just kind of snap right back and head to work?
We're at a point now where I'm going to say about 600 milligrams of Motrin or ibuprofen can usually relieve the symptoms just all by itself. In addition to that, we can have them take Tylenol. Now, with the way things are, not only in the state of Tennessee but across the country, there's a lot of abuse. But we can't really call in prescriptions anymore. So I do write prescriptions for my patients now. Sometimes, if I think there may be a little bit of tenderness, but most of them tell me they didn't even get it filled out. But just because we can't call it in, I do give them something to back it up. But you're right, ibuprofen, Motrin usually will take care of it almost 90% of the time, 95% of the time.
Okay. And if you're out watching right now and you're thinking about just, in general, not necessarily just about a root canal, but maybe you've had some dental work and your mouth is sore, or your teeth seem to be sensitive, and you have a question, you can call us anytime throughout the next hour at 737-7587. That's 737+. Right here for the next hour, we are talking about your teeth, we're talking about your mouth. We also like to talk kind of in general dentistry terms about some of the things that I think a lot of people face and questions they have, from whether or not it's about flossing, whether or not it's about how you brush. Sometimes you get a tooth that's chipped and you're thinking, do I need to go in and have the dentist look at that? Just because a tooth is chipped, or do I need to wait until, or should I wait until, it might become a problem? So we've got a lot of things like that for you this evening that we're going to be talking about. Now, getting back to root canals, is it possible that a tooth would recover and not need a root canal? If it gets to the situation where you might need a root canal,
where you have discomfort,
yeah,
and then it can heal itself. Oftentimes, doing getting dental work done, people don't. Sometimes you may get a filling, and it is a surgery of some kind. And kind of, if you have surgery on your leg or your arm, your shoulder, or whatever, there's going to be post-operative tenderness. And sometimes when you get a filling, there is inflammation there, and it's reversible pulpitis. The tooth can be a little bit tender, and the pulp does an incredible job of just healing itself. And oftentimes things will kind of calm down over time, and they'll diminish. But if there is tenderness, it's still better for you to go ahead and come in so that nothing becomes emergent. But if oftentimes, if there is a little bit of tenderness and we think it might be reversible pulpitis, again, we may make a minor adjustment and just try to see how things go over the next few days. But the nerve is very capable of healing itself, and does often.
All right. Well, again, if you're just tuning in, you are watching Open Line. We are talking about your teeth, your mouth. It's Ask the Endodontist. We're with Dr. Richard Horwat. If you have questions, all you have to do is give us a call at 737-7587. We are going to take a short break, and we'll take some of those calls when we come back. So come on back with us.